I would like now to ask Agnes to start presenting. She will provide us some insights and learnings from the pilot campaign that was run in the Netherlands. Agnes, please.
Yeah, thank you for the floor, Marjolein, and you will do the slides. So
yes,
slide please. So we did a pilot study within the conception project, but of course we do a lot of campaigning ourselves, also besides the conception project. And what we want to do is stimulate participation in our pregnancy register in our country. And I want to share some experience of us of a couple of latest year. Next slide, please. The cause of campaigning is, of course, increase brand awareness, because we have a brand. It's called Moeders voor Morgen, but in English translation it is Mothers for Tomorrow. And of course, you want to gain awareness of your brand. We also want to disseminate information. We have a lot of information for pregnant women and drug use during pregnancy. And of course, we want pregnant women to find this information. So that's also a goal we have. And last but not least, of course, we want to increase the participation of our pregnancy register. Next slide, please. So we did a lot of things. At the start, we designed our website and we designed our information materials. Here you see the website. Next is we developed a flyer where we explain why it's important to participate, and this flyer can be reached out to pregnant women. And we also made a brochure, and in this brochure there are common discomforts during pregnancy and which medicine you can use and not use. So this is information, but information we always connect to also invite pregnant women to participate in our research and our pregnancy register. Next slide, please. So one of the important ways we invite pregnant women is by their midwives. We have two ways in doing this during the process of the healthcare of the midwife of the pregnant women, during the caregiving. One of them is, you see this on the right, is that if a pregnant woman goes to the midwife at the first consult, then there are all questions where they are running to in this intake. And one of the questions is, are you interested in participating in this pregnancy register? And if there is going to be a click on the box with a yes, then the pregnant woman will get an invitation to participate from email from her midwife, but the email is from our Mothers for Tomorrow to join this research. And next click, please. On the other side, on the left side, you see another way of a little bit of the same. There are also midwives working with a pregnant portal, where there's a digital tool to communicate with their pregnant women we do have in care. And through this tool, the midwife can send on certain times messages to the pregnant women in healthcare. And one of the messages that is be sent is right after the start of the pregnancy, that they can join our pregnancy register. And this is a message they get why it's important to do so. Next slide, please. Another ways we do campaigning is marketing via information. That will say that we have information to share about, in this case, information on painkillers, what can you use and not use during pregnancy, but also on medication on high fever. And then we make a short, well, information pamphlet, and we put that on social media or on website for pregnant women. And also we all combine that information with also invitation to participate, how we can get more knowledge on these safety issues by participation of pregnant women. So we make a combination of information and getting them to join the register. We do this on websites, what are quite popular for pregnant women, as one is called 24 Baby, and there we can put out these messages. Another slide, the next slide, please. We also do marketing via information in a more active way. And we posted a quiz on our website, and then the question asked, what do you know about use medicines during pregnancy? And through these questions, we will come to information, share information with women, but also in the end, ask for participation in our pregnancy register again. Next slide, please. And we also do a marketing via banners and advertisement. Of course, it can cost you some money. And here also we like to ask questions. On the right side, you see just a general banner where pregnant women are asked to join and why it's important to join. But it's all in Dutch. Sorry for that. But on the left side, you see asking a question. Can I use this this medicine with this complaint during pregnancy? Can I use ibuprofen during the second half of my pregnancy if I have pain? And through asking questions, and women are actively answering this question, you can get easier. You can then easier join your message. And in the end, of course, we asked them to join our research. Next. Yes, we also did this in some more advanced way by conversational ads. It will say you have an ad, and with this ad you reach out to pregnant women on social media and you start asking a question. And the first question is, are you pregnant? And when the answer is yes, you have another question. And then so you also can get women involved in a conversation, and then in the end you also ask whether they want to join the pregnancy register. Next one, please. Of course, we have a special situation last years of the COVID pandemic and the discussion about COVID vaccination for pregnant women. And we get a lot of free publicity by this. It was in the news. In the left, you see a news coverage message about also pregnancy and COVID vaccination. And here again, within the media, there was a message that they can join the research on the safety of corona vaccinations. And on the right, you see another thing, that is, if a pregnant woman did go get a vaccine, then at the vaccine site, all people will getting vaccines get a questionnaire on health status issues. And one of the questions in this mandatory questionnaire was, are you pregnant? And if the answer is yes, and there's pregnancy, there is a text below it where they were referred to us to participate in the pregnancy register. So that was quite important that all pregnant women who get the vaccination did see this text prominently. So next slide, please. So this were a couple of examples of the things, pre-publicity, but also the things we did to get participation within our pregnancy register. And here you see the inclusions as a result. And then you see quite clear peak moments of inclusions. One was the start of the COVID-19 vaccination. And then you see, because of this attention in free publicity, but also at the vaccination sites, we got a lot of inclusion of pregnant women within our register. And also you see the pilot campaign, you see also a peak in inclusions. And in the end of the last year, that was not a part of the pilot of conception, we again did a little campaigning, not even that much. And in the last month of the year, and you see also there, if you do some campaigning activities, you see an increase in the number of inclusions. Next slide, please. If people do join, if pregnant women do join, then we also ask, how did you hear from our register? And what made you aware of that you can join this? We asked that, and then you see the blue one is the vaccine by the vaccination information. So here you see again that the COVID vaccination and the information they get at the vaccine site were quite important for getting inclusions. But you can also see that healthcare providers ask through our email, and also by the digital communication by the healthcare professional with the pregnant woman, also are very important ways to get inclusions for our register. Last slide, please. Yes, some conclusions. Well, you could see there's a high impact of COVID-19 vaccinations on the number of inclusions. Of course, you don't want the pandemic, but in this case, it did work to get more. We believe, and we have the experience that giving and taking does work. If you give pregnant women small messages of information, or ask questions and give them information, that also give an interaction that lead to inclusions. And if you do some advertising, or you do some exchange of information and make banners, then you should be there where pregnant women are. What's quite obvious, of course, but you have to be very targeted at pregnancy sites where pregnant women also go visit. And I think our most lessons for our last couple of years, most important and most sustainable message is you need support from healthcare givers. And in the Netherlands, that are the midwives. And if you can have something in place, digital way is best to get them an invitation for participation. That's the best way to get inclusions and get awareness of your pregnancy register. Well, that was my last slide. Marjolein, thank you for your attention.